kind of walk us through what happens once they're cleared and ready for the surgery?
It's a matter of bringing the patient to the operating room, but in terms of the hardware or the stems and the cups, hip replacement is taking the patient's native anatomy, which can be eroded and worn down, and replacing the ball with one of the various types of metals or a ceramic implant. And the other side, the cup portion, is plastic. It can be metal, it could be ceramic. Most commonly nowadays, it would be a plastic cup laid into a metal shell, and then one of the various types of metal or ceramic heads.
Gotcha. And I want to talk a little bit more about that a little later on.
Sure.
But let's take a quick look at a graphic here we have for some of the reasons for hip replacement. First one's arthritis. That's a big one. Can you kind of talk us through some of these?
Arthritis is, it's a generation, and arthrosis would be the term for an x-ray that has changes from wear without necessarily the inflammation or the pain that go along with those changes found on x-ray. But that's probably the most common. Hip dysplasia is referred to as a condition that is abnormal anatomy that is found in the hip joint. It can be ranging from the cup portion that's worn separately, or from different changes in the femoral head, which is the sphere and the ball in the socket. And that can lead to arthritis and the wear and the pain associated from those changes at an earlier age. Gotcha.
Do you operate on all these? Have you seen all of these in your practice? All these reasons for the surgery?
I have. Some of the hip dysplasia cases tend to be more complex and require more advanced surgical planning, and I would refer to a joint specialist, a joint surgeon.
Okay, gotcha.